It's a pleasure to join you today. It's a pleasure to come to you to Stony Brook. I would have loved to be there in person, but unfortunately, we are in uncertain times right now, and this is how we have to do it. So we all have to do our part in being, self-isolate, social distance. So it's good. Um, Before we get started, I just wanted to bring your attention to a case today. Can you guys see this? So this was the case from today. This is a fresh case that I wanted to show you guys. So 35-year-old man who came in with fever and tiredness and muscle aches, really young guy, had no other medical problems, was fine and in really good health. And he just had this 3 days ago. 3 days ago, no travel history, has not traveled out of Los Angeles. So I'm from Los Angeles. I mean, I'm talking from Los Angeles. No travel history. He had not come in contact with anyone with any problems, and he's social distancing. He would go for walks in his neighborhood and nothing else. And we scanned him, and that's what we found. Can anybody just volunteer and say what you think you see? Anything at all? Anything you think you can see here? In radiology, black is air, right? So black is air. There's one big organ in your body that has a lot of air in it, right? So what organ will that be?
Your lungs?
The lungs, right? Who said that?
I do, Dr. Kubi.
Okay, good, good. You have 5 brownie points. Each 5 brownie points is worth a pen, right? And yeah. So everything you see here that's black is air. And all this stuff, that's all lungs, right? So you want the lungs to be black. That means there's this air, right? But then this guy has some white stuff in there, and I'm sure we can all see, right? He has all these white stuff in there. That's I can't. Yeah, all this stuff. That's not air. That's not good. And all this stuff, that's not air. That's not good, right? And all this stuff, that's not air. That's not good, right? So can anybody just play doctor for 2 seconds and try and diagnose this guy today? Someone. No, well, not you. Anybody else? Anybody else just diagnose this guy? What do you think it is?
Could it be pneumonia?
Pneumonia. Yeah. So who just said that?
I did.
Okay. What's your name again?
Jamal.
Jamal. Good job. You have 5 brownie points. Okay. Pneumonia. What kind of pneumonia? What else?
I have no idea, to be honest.
Anybody? It's 2020. It's March 20. It's April 2020. What could it be?
SARS?
Yeah, COVID-19, right?
Oh, COVID-19.
So this guy has COVID-19, right? And that was from today. I just wanted to share that with you. One other very cool feature that you rarely ever see is this stuff, right? When you see air in the tubules going into the lungs, we call this an air bronchogram, okay? So air bronchogram is when you see all this stuff, the tubes with like air in it. That's not a good sign. All right, now let's go to the talk, right? I thought this was a very cool case from today, and I just wanted to share with you guys, So this was a COVID-19 case. Okay, so global health. So I'm gonna tell you guys a little bit about myself, So my name is Emmanuel. Obviously, I was born in Ghana, and I grew up in the pharmacy store. Growing up, my parents had a pharmacy store and I loved it. And I just would help my mom in the pharmacy store every day. The pharmacy store was almost like a clinic. We took care of people in the community, and that's what we did. And that's what we did. And people would come to us, hey, I have malaria, and then we give them medication, whatever. So I grew up in almost like a clinical setting. Then my family, after high school, my family moved to the Bronx. So I moved here with my parents and all that. Then I went to University of Buffalo because I couldn't get into Stony Brook, I had a great time at the University of Buffalo. I was a pre-med there. I was a double major. I was chemistry and biochemistry double major. And if I had to go back, I probably would have changed it, and I would have been a Spanish major, a Spanish major and a music minor, and still be pre-med. And then I ended up in med school at Albert Einstein College of Medicine. Who knows where that is? That's for 5 brownie points. Yes, Nicole?
Manhattan.
So the school is in Manhattan. Good job. Who knows where the hospital is?
The
Isn't it in the
Bronx.
Bronx?
The Bronx. Two people said that. So Nicole has 5 brownie points. Who else?
Maisha.
Raphael, I said that. Yeah.
Good. So yeah, so I went to Albert Einstein College of Medicine. Then I started off in general surgery. I did general surgery for a couple of years, and I realized that I just needed to change fields. I needed a less intense field. General surgery was a lot of fun. I enjoyed operating on people and trauma, and it was great. But I just wanted a career that would be a little bit more slower paced. So after a couple of years, I switched and moved to. So I did general surgery at Montefiore Hospital in the Bronx, my school's hospital, and then moved to Los Angeles, UCLA, to do nuclear medicine. And I love it. It's basically radiology. You know, we take pictures, CAT scans, PET CTs, PET MRIs for all these cancer patients, all these patients with coronavirus and this and that. I love it. So at some point in my first year of med school, first year of medical school, my school just gave everyone $3,000 to go abroad, go to a third world country, to do whatever, you know. And most medical schools do that. They provide people with a chance to go abroad and provide care. So I was the guy from Africa, you know. My friends were like, "Hey, we have to go somewhere. Can you help us out?" So I was like, "Okay." So that was the first nudge. So I had to create something to get my friends to use their $3,000 so they don't lose it. So I created a global health program, and I took months to set it all up, but my deans were very supportive. We set up a program in Ghana, and then the first year, it was about 12 of us. 12 of us was a big group. 12 of my friends from med school just went to Ghana to try and work, in Ghana. And that was the first mistake I made. The dean told me, "Hey, 12 is a big number. Just take 3 people." I said, "No, these are my buddies. You're going to have a great time. 12 is good." And yeah, we did go there, but it was definitely a big group, and it was a challenge managing 12 people for the first time. But it was good. We got into the communities, and we were able to do a lot of work, and we helped people, so it was good. So global health, what is global health? It's basically just understanding healthcare of people globally, from looking at the world, from a world perspective, and that's what it is. And it's basically research and clinical work and public health, and just getting outside of the box, if you will, just not being stuck in just Los Angeles or the United States, but looking outside of the box, right? And it's about realizing that the care we receive may not be the same as the care that somebody in Costa Rica may be experiencing, or someone else in Norway may be experiencing, right? The folks in Costa Rica may have a little bit of a less resources than we do. People in Norway may have more resources than we do, so it's good to understand all these things and try and fit it all in, because we live in a global village now. The world is one small place, right? And we all more connected than ever before, right? It's every city around the corner, around halfway around the world, is just one plane ride away. All right, and who agrees with me that the healthcare problems in Costa Rica can affect us? Anybody? Yeah, or healthcare problems in Ghana or London or Wuhan can affect us. Yes, it can, right? And we're just seeing it right now, how important it is that we all understand world health from a global perspective, and to understand, how healthcare works. If we didn't know how healthcare works in Wuhan, we wouldn't be able to tackle this coronavirus pandemic that we have right now. And that's why global health is very important, And also sometimes with the very little that we have, I'm beginning to realize that with the very little that we have, we can touch more lives, and I'm sure most people here somehow want to go into the health field, or are interested, or are pre-meds. Is there anyone here who's a pre-med? Most of us are? Oh, I see, yeah. So we're all interested in helping others, right? And global health gives us the chance to do that, right? And it's not, I remember I was listening to a talk from Denzel Washington, and he was saying that he's never seen a U-Haul behind a hearse, meaning that you can't take it with you, right? Whatever you make on this world, you can't take it with you. So it's about making an impact on people, right? Making an impact on others, and being able to influence others. And we do have what it takes to influence populations around the world, in our communities and around the world. So global health includes Costa Rica, Ghana, Wuhan, but includes Buffalo, it includes Alabama, it includes the South Bronx, and we do have the resources to impact all these people, right? Even if you can't go all the way to Costa Rica, you can go to the South Bronx, and I'm sure some of you may know something, you may know a thing about viruses, about STDs or sexual health. All it takes is just getting 2 or 3 of your buddies together. Hey, how can we help these people? Maybe we can go into the South Bronx and give a talk, go from door to door, create a little pamphlet. Hey, condom use every time you have sex saves lives. Maybe that's what you can do, but that is global health. That's not Costa Rica, that's in the South Bronx, but that's global health. You may be doing this in Buffalo, but it's also part of it, right? People need help everywhere, and it's about coming together, galvanizing our resources to help people. And that's what medicine is about, medicine that we all are trying to get into. That's what it is about, just being able to help people. So I've been able, and my school definitely helped me with that. They helped me create this global health to help, try and contribute to healthcare around the world. So I go to Ghana with my buddies, and I realized one thing, that maternal mortality, it's crazy, it's insane, pregnant women are dying for no other reason than just because they're pregnant, like literally women get pregnant and they die. Just they're not sick, nothing, just by being pregnant, and that's maternal mortality, and it's crazy. And I just couldn't understand it. So at that time, it was just doing what I could with me and my friends, just going into communities. We were medical students at that time. We were first year medical students. This was like 2011, we just get into communities and then try and help and contribute. And there were pregnant women lying on the floor. And I'll tell you what, that a lot of these deaths, I realized just from being there, was that a lot of these deaths were from bleeding. So when you go give birth, anyone from 18-year-olds, 20-year-olds, 25-year-olds who just got pregnant and they're giving birth, and then you can bleed. Most people bleed. But there's one tablet called oxytocin that here we give to pregnant women just so they don't bleed, right? And that one single tablet, the whole bottle of like 1,000 pills cost $2. So for $2, we can save 1,000 women from getting pregnant. And it was just mind-boggling to understand this, that so oxytocin is not available to them. And for $2 for 1,000 pills, they need just 1 pill of oxytocin to prevent bleeding. They're just dying. And I was like, wow, that's incredible. I can save 1,000 people with $2. I'm a med student, I don't make money, but $2 and buy 1,000 pills of oxytocin. This is easy, So I was able to understand the power that I had as a student, to be able to affect lives around the world. And to be able to understand this, like 330 pregnant women dying out of every 100,000 live births. It's about maybe like a couple of years, It's like 3 Boeing 737s filled with pregnant women crashing every so often. It's just insane. Like 3 of them every couple of years would just crash, right? And it's just insane, and it's mind-boggling, and I couldn't believe it. And I had to think, re-strategize, and commit myself to trying to solve that. And just by being there, going every year, I realized there were 3 things that were very important. It was money. People didn't have the money to go for care. The whole bottle is $2, but they can't even afford that for 1,000 people. $2 for 1,000 people, and they can't afford it. It's crazy. People can't get accessibility. They can't get to the hospitals. The closest hospital may be a 2-hour drive away. If you get pregnant and you bleed in, you have like maybe a half hour to live before you die, and if the closest hospital is 2 hours away, and then sustainability, sometimes they bring healthcare vans into villages to provide care, but it's not sustainable. Once every 6 months is not good enough, So it was interesting understanding these things, and So and then so I became a resident, and then my goal in residency, my goal throughout all of medicine was to establish my own practice, and I've been able to establish my practice last November, so it's still relatively new, and it's right here, Kubi Medical. So yeah, I was able to achieve, just check one thing off my bucket list, and it was it's a proud moment for me being able to, open my own practice. And I just wanted to do primary care, but the business guys were like, hey, you're in LA, primary care. Hey, these guys, they're concerned about cosmetic medicine, and they want Botox, they want like liposuction, boobs implant, and butt implant. So as much as I wanted to open a primary care clinic, the business advisors realized that, hey, maybe something cosmetic. So I was like, you know what? I don't want to do boobs and butts yet. So let me just do weight loss. So that's cosmetic, but there's also health benefits to that. So I was able to open that clinic in Los Angeles. It's in Los Angeles, but that's also global health. We're taking care of all these superficial movie stars or whatever, trying to keep them skinny. That's also global health, I guess, But yeah, I was happy about that. But on the other side, as you can see here, this was a picture from 2019, December, about 3-4 months ago. We went to Ghana. There's some guy here on this call who also went with me. Solomon Nawab was on this trip. We went to Ghana, and this was the village of Sapo. I put this village first for one very critical reason. They provide maternal and women, but they have a very interesting financing model, how they sustain themselves, how they provide. Because if you charge these villages $1, no one is going to show up to the clinic. They can't afford it. So what they did was they have like acres and acres of land. So the nurses, literally the nurses and doctors, farm. They plant maize and corn on the property, sell the maize and corn, and then use the proceeds to sustain the clinic. And I was like, wow, that's insane. That's crazy, So we showed up, and there were some local doctors and some foreign doctors and nurses and midwives and some students as well. There were a few pre-med students who came on the trip who went there and they helped the doctors to take care of these people and provide care. But it's not sustainable. We're there for just one day. It's not sustainable. And it was just painful just seeing all these people and like, man, they have to come. They need follow-up care, but you can't provide that. We can only be there for a day. And it's just interesting just understanding these things. And this made me change my approach. I decided that I'm going to try and start up clinics in impoverished areas. So this was the first clinic that I set up in Ghana. Like I said, money, sustainability, and accessibility. So money, so we said free services is going to be free for everyone who comes. Accessible, so it's right in the middle of the village. I also wanted to tackle 2 countries. So I put it right on the border between Ghana and Togo. So it serves 2 countries. So if you're from Ghana, you could get free service. If you're from Togo, you could get free services too. And it's accessible, it's right there, and it's sustainable because it's there. We're not coming and going, right? Because if we come for a day and leave, people need continuous care. So this was a very big endeavor, a very big adventure that we did. And I did nothing. It was just the pre-medical students who did everything. And someone is smiling because they know they put in a lot of work here, So Solomon Wab and definitely helped a lot, All the students helped a lot, and they did all this work. I was amazed how they were able to work together and start this clinic on their own. I provided guidance, but they were able to start a clinic. So if you're a pre-med student and you're already starting a clinic at 18, 19, 20, you probably will rule the world at 25. And it's just kudos to these students that did so much work. And we're really excited about this, that we were able to set this up in the community for them. And the people enjoyed it. Unfortunately, though, I had to shut the clinic down as we were leaving. There were a lot of logistical issues, a lot of challenging issues, the nurse and how to staff the nurse and work hours, what time should we keep it open, and a few other things. And I'm like, I'm a medical doctor. I mean, as much as I'm opening a business, my business knowledge is still in its infancy. I'm still, so I still need to kind of re-strategize and figure out the uh, the processes, kind of put everything back in place. We have a nurse, we hired a nurse, but I put her on leave and she's enjoying like 3 months of leave so far, now I'll put a structure in place and reopen it again, just when to open, when not to open, and flow and approach, who overlooks the nurse to make sure she's doing the right thing. And I think if I probably will give it to the next batch of students to solve the problem, I may be a good adventure for the next batch of students, and maybe they could put it on their resume that they built a clinic too. So that's that. That was the first clinic we just built 4 months ago in December in Ghana, and we're very excited about it. We will reopen it at some point, probably next December. And this was one of the other villages we went to. It's called Jakiti. These villages were interesting. I had a case, a special case of a woman with multiple sclerosis. Who knows multiple sclerosis? Just go. What is it? Anybody want to say what multiple sclerosis is?
Isn't it an autoimmune disease that targets Schwann cells in the peripheral nervous system?
Excellent. Who said that?
Raphael Verts.
Raphael?
Yes, correct.
Yeah. Hey, I think you should skip med school. I'll give you your degree already, your MD, right?
Okay.
Yeah. So yeah, no, yeah, definitely. It's exactly that. So it's it attacks autoimmune disease where it attacks your nerves, your nerves and the nerve sheet around your nerves, and sometimes it comes and goes. It's called the remitting relapsing. There's the progressive version of it where it just comes and stays and gets really, really bad. And this woman's on, it looks like it was the more progressive, the primary progressive type, where it came and it stayed, and she could barely walk. She couldn't even walk. I have a video of it. I just had trouble uploading it here, so I just couldn't, but I will share it with Solomon, and he can forward it to you for you guys to see. It was a very cool case that I was like, man, how is this woman in this village? It was really that they have really bad roads, that it's so bad getting to this place. It's just incredible, I'm like, how is she going to be able to get into the city and get care, because it's a pretty critical disease that needs very close attention. So I thought it was very interesting, So we went to this place and we enjoyed the day here, and I remember we wanted to leave, and Solomon was like, no, he wanted to stay, and I was mad, but I understood him, and we went back and we saw more patients because Solomon wanted to see more patients. So that was good. A big applause to you for your, care and attitude, and we were able to see there were tons and tons of patients, but hey, we liked it. But most importantly, we were able to understand the problems of this community, knowing that the village is really hard to get to. It takes it's a really bad roads, and just getting close to them, knowing that hey, these guys have the same problems we have in Los Angeles. They have multiple sclerosis too. It's not just people in Los Angeles that have this. These guys have that same problem and they need help too. So how can we help these guys? Probably a clinic. And I think I'm putting plans in place to start a clinic probably next December. Maybe the next batch of students I'll give it to them, I'll give them direction, and we'll be able to put a clinic together for them, This was another village, another village called Ekutua. So it's close to where my parents are originally from. We focus a lot on pediatric care, and we took care of a lot of these little kids. Trying to, also understanding them. We were just there for one day, but just being there for a day, knowing what the challenges are, the healthcare problems are, understanding these guys' problems gives us a chance to help them, right? Because, for example, now we know that pregnancy, just one tablet, a whole bottle costs $2. So we're able to strategize ourselves and plan and this and that and be able to help them, and it was good. Yeah. So yeah, that was that. And this is the whole team here. This is, well, part of the team. These are all the, so there are two doctors here. So myself here, and then Benjamin Yoik. He's a German doctor. He's a doctor from Germany, and he definitely came to help me. So between the two of us, between Dr. Joik and myself, we were doing a lot of teaching and kind of coaching these really brilliant guys here, and trying to help them, understand, all these things. And they definitely got a lot of good hands-on experience working with patients and teaching them. We focus a lot on the medical interview with the students, just so they're comfortable knowing what questions to ask and how to talk to a patient and this and that. And so I'd like to talk about this girl here. Her name is called Taylor Stone. So I had talked to her before the trip. She had no interest in going into medicine. She was she has a great voice. She sings, and if she were to sing right now, we'll all fall asleep. She's like an amazing singer. But she was in the field of trying to understand her path, trying to find herself, not knowing what to do. So she talked to me, and I was like, okay, well, you can come on the trip, and since you're in showbiz, you can take charge of the audio visuals and try and turn the whole trip into a film, since that falls into your category. You're in showbiz, and maybe something may come out of that. So Taylor was a showbiz person. She took all the pictures, and she enjoyed being in Ghana too, and we went to the safari together, saw all the lions. One time we went to a village, and we were overrun, overmatched. It was chaos. It was chaotic, and it was just upside down. Everyone was mad at me. I was mad at everyone, and it was just crazy. And then we couldn't find someone to be our pharmacist. So everywhere we'd go, we'd have our medications, and I had one pharmacy assistant. For whatever reason, that day it was just insane. There was just too many people, and I needed someone to help me dispense the drugs. And Taylor was like, you know what? Don't worry, I'll do it. So Taylor volunteered to dispense medication. I'll teach her, hey, this is how you do it. You write this on the prescription pad and tell the patient one in the morning after meals, in the afternoon after meals. Then, after that day, Taylor came up to me and was like, you know what? I think I found my calling. I want to go to pharmacy school. I enjoyed that so much. I enjoyed giving out the medication that I want to go to pharmacy school. But now Taylor is not going to sing anymore. Now she's applying to pharmacy school. That she came to do audio visuals for us, but she ended up now going into pharmacy school. So that was really good, and I felt really happy that I thought I was bringing her to help her find herself in audio visuals and all this showbiz, but she's going to be a pharmacist now. She's going to go into a PharmD and become a pharmacist. So yeah, that's her. Everybody else though is pre-med, applying into med school at some point, so yeah, that was pretty good. This guy here is a local chief of the community. He's a local chief of the community that we went into. Very supportive. He literally donated the house we use for the clinic to us, and we just had to just paint it and refurbish a little bit. But he was happy that we bring in service to his community. So he's like, hey guys, I'll give you guys a free house and you can use it for your clinics. We're like, okay, sure, we'll take that. So we were really appreciative of his efforts. We converted the house into that clinic. So that was a house he donated to us. See, there's a big stretch here. So I'm sure the next batch of students can get creative and maybe use that for maybe lab services, or just convert that into like a ward, And, I guess we can just put some beds in there and, just continue to develop our project. So yeah, he gave us this whole compound, and we really thank him a lot, And this was the bigger team, including everyone. So we had our nurses here, our local nurses and midwives. I think she was a midwife. That was our driver who drove this van. This van would take us everywhere we'd go. And that was our coordinator, just coordinating everything, making sure we're all well fed and providing us with food and drinks and and all our nurses and midwives here, and we enjoyed being there. It was just a good experience. So yeah, he fed us and made sure everything was all organized. And her too was a midwife, really good. And yeah, a couple of the nurses, local nurses and midwives here, and it was excellent. So this guy back here, I can't see him because he's covered, but he was an ultrasound tech, and it's very important in maternal care to have ultrasound services, because you need to be able to identify what pregnancy requires surgery or pregnancy can't be delivered vaginally and has to be sent to the city, so you don't even attempt a vaginal delivery. So the ultrasound services is incredibly critical, incredibly important for him to be able to diagnose these women, right? Because the midwives are just really good at vaginal deliveries. They're excellent with it, but anything past that, like C-sections, they can't do that, and they shouldn't do that. So we need our ultrasound guy here, to be able to tell, if our pregnancies are like high risk and need to be taken to the city. Because I'm gonna tell you guys one thing, just so you sound really, really smart, right? So one pregnancy complication, that's an emergency that should never be attempted, that you should never attempt vaginal delivery. It's so with the uterus, at the bottom of the uterus is the cervix. So when the cervix opens, the water breaks and the baby comes out, right? But sometimes at the opening of the cervix, there will be a vein, right? There will be a vein there right at the opening, meaning that when the water breaks and the baby is coming out, that vein will break too, right? And the baby will bleed to death, and both the baby will die and mom will be in very bad shape, right? And that's called vasa previa. So from now on, if you ever go into any hospital and they're delivering, and you want to sound really, really smart and show them that you are from the University of Stony Brook, and then a really smart question you can ask is, oh, hey, so this woman is going to deliver. Do we know that this woman has vasa previa at all? If you say that, anyone's going to be really impressed with you, right? So remember that, write it down, and don't forget. Vasa previa is when there's a vein underlining the opening of the cervix at the opening of the uterus. So when the ultrasound guy sees that there's a vein there, no vaginal delivery. It has to be taken to the big hospital. So they attempt a C-section, all right? So vasa previa, remember that, all right? Remember vasa previa, and then whenever, it may be in 3, 4, 5 years, you may be in an OB/GYN rotation, and as the medical student who knows nothing, just be like, hey, doctor, do we think this lady would by any chance have vasa previa at all? If you say that, they'll look at you like, wow, I'm gonna write this person a letter of recommendation, okay? So don't forget that, all right? Okay, so yeah, so this was one other place we visited this queen mother. She's a queen of a really big empire back there. They were having an anniversary celebration. They invited us, the whole team showed up. We had a great time working with them. Yeah, we had a great time working with them, providing free services for them as well. It was good, And then, yeah, so that's our annual winter program. We have it every December, and the application is available at my website, kubimedical.com. And students are welcome. This year we have, it's very, the coronavirus is kind of making things difficult, but we are all the way in December, so I guess we have some time to think about things before we kind of get going. So if anyone is interested, you can definitely apply there. And we have my colleague, she's a physician assistant who's doing her master's in public health and global health right now. I'll let her lead the mission this December. She's really good, and she's in neurosurgery. She's in pediatric neurosurgery right now at NYU, and she's really excited. So I'll have her lead the whole project, and it's gonna be good. Quiz. Let's see who can answer this. What's an air bronchogram? Anybody? So what organ do we see air bronchograms?
Isn't it done to see where the lungs are filled with air and where they're not filled with air?
Excellent. Jesus Christ, you guys are killing it. Oh my God, who said that?
Raphael Verts.
Oh, the doctor. Hey, Dr. Ralph. How are you doing?
Yeah.
Yeah,
I'm good. I'm good, and you?
Yeah. Good. You have any patients today?
Sorry?
Do you have any patients today?
Unfortunately not.
Oh, I see. Hey, good job. That's impressive. Okay, anybody else? Raphael, you on MD, so you are not going. Anybody else aside from Raphael? When you have a vein at the opening of the cervix underneath the uterus, what is it called?
Vascular preview.
Yeah. Who said that? Well, yeah. So it looks like we have multiple doctors on here. So yeah, no, yeah, that's that. That's vasoprevia. So yeah, air bronchogram is when you have the, you know, you can see the air within the lobules in the lungs, you know, which you shouldn't see. Then that's like not good, you know. All right, so yeah, so that was that, and thanks to Stony Brook University. I want to thank my students from last year who came, and especially Solomon and Nawab. Thanks for coming last year. Thanks for all the work you do. They still keep calling me. All the villagers calling, asking about you. So good job. You made a good impression on them. They enjoyed you being there. Any questions at all?
Excuse me. I have a question.
Mm.
I don't know if I caught your email at the beginning. Can I get your contact information?
Yes, yes. Goodness, I should put it in here somewhere. All right, my goodness, I should have. Yeah, so it's I'm gonna put it in here just so we can all see it. You know what? It's info. Okay, hold on one second. I should just. So it's info@kubimedical.com, or my name, Emmanuel.kubi@kubimedical.com, right? So Emmanuel.kubi@kubimedical.com, all right? Yeah. And then, hey, Noab, can you type my private email in the chat box as well?
Yeah, of course. And we can email it to them after as well. So
Yeah. Is there a chat thing here?
yeah.
Oh yeah, there we go. So let's. Oh, this. Okay, there we go. It's So yeah, that's that. That's that, and I can even choose. And that's my phone number too. So if anybody wants to reach out, any questions at all about global health, about medicine, about pre-medicine.
I have a question.
Mm-hmm.
What were some logistical issues that you faced regarding the clinic?
I think. Well, the first logistical issue was just I was just lazy. I just wanted some students to do it. No, I'm just kidding. But it was because well, I needed someone to overlook the nerves and to have processes in place, right? Because I didn't have, so when we were there, it was easy because then I could be there and I could run things and I could manage things, but I didn't have a plan when I'm not there, Because when I was there, I was like, okay, patients will sit under the tent in the waiting room. They will come in at this time. This person, you take blood pressures every time and then give the number to the doctor. The doctor, you can see them, prescribe medications. Really sick patients could go lay down in that little room. But if I'm not there, and then I was just really busy at that time, going from village to village, that I didn't have time to put in place processes, because I did have the staff. We do have the staff. We have the nurses and midwives. It's just about just defining the processes for them, that, hey guys, this is what you do. This is where you come in every day and then see these patients every day. And then, if it's an emergency, do this or that, so just, and these things require just thinking, right? What if a patient comes in and they're really sick that they have to, what should this nurse do? They probably will call me here in Los Angeles, like, hey, I have a really sick patient. We need to have a defined you know, or maybe speak to a taxi driver. Hey, we'll give you a $5 every month, you know, and if there's an emergency, you come take the emergency to the big hospital or whatever, you know. All these things had to be put in place that I just didn't do that, you know, and it's not much work, you know. I just need to find time and think and, you know, put a real structure in place and also have an oversight over nurses, you know. It's always, whenever you know someone is watching you, you're a little bit more responsive. So and I found someone who volunteered. I found like a clergy guy, you know, some religious preacher, you know. He was willing to just volunteer his time and overlook the nurses on our behalf, just to make sure everything is going as planned and this and that. And, you know, so yeah, that was why I had to close it down. But I have the nurses, I have the midwives, and I just need to define the structures, you know. And yeah, I'll let the next batch of students do that. That would be their job, I guess.
Thank you.
Any other questions?
Dr. Kubi, I just had a quick question. Regarding the applications, when can students start applying? Is it as soon as possible, or since the next trip is on hold, or is there like a certain time they should start applying? Or?
Whenever.
Whenever?
Yeah, whenever. You can always go ahead and apply. And yeah, and if anybody wants to volunteer and needs some volunteering help, I trained in New York City, so I have a lot of friends in the area who can, you know, help you guys shadow and get some clinical hours for your application and this and that, to get one more person to write you a lot of recommendation when you're applying to med school and this and that. So definitely do that and keep studying really hard, and you know, just don't try and be a bio major if you're pre-med. Just do what you're passionate about. If you want to be a French major, just go ahead and be French major and just take biophysics, chemistry, or go and just be a French major or music major or whatever, you know. And it's gonna be good. Oh, and research. Don't forget your research. Definitely try and email some professors and be like, hey, you know, can I do some research with you or whatever, right? Any other questions?
I also just want to highlight the fact that with these trips, that what makes it so amazing is that the only thing you really have to pay for is just like your plane ticket. I don't like all the money you need to bring just for like spending money, but the only thing you really need to have to like pay for expense-wise is just the plane ticket. And if you get it relatively early, you can get it as cheap as around like $900 or even like $1,000. But that's pretty much the only expense you really have to pay for. So.
Yeah. Definitely that. And yeah, definitely had a lot of fun too. Went into all these different touristy sites. Went into the safari. Hey, Nawab, did you go on the safari that day? I wasn't there, but I heard you guys went. Did you go?
Yeah, we went on the safari. We saw an elephant. We got really close to an elephant, but like as soon as we kept getting close, it was like a distance you had to have because some of them aren't used to people and they're in like their natural habitat. But we saw elephants, a lot of antelopes. It was really amazing. So
good.
There's a lot of cool, yeah.
Yeah, there's a question here. If there's any preparation we need to do, like vaccination, and yeah. So the vaccination, yes, there's one vaccination that's required as yellow fever vaccination. It's free. There's the clinics in the Bronx and in Brooklyn that give that for free, and I can provide that for you, or Solomon could provide that for you. Just go there and get your yellow fever shot. That's absolutely required. There are other ones that are recommended, like the hepatitis B and rabies and this and that. Most people have that already. The trip has always been 3 weeks, but I'm thinking about making it 2 weeks for just this year, you know. What do you think, Solomon?
I thought 3 weeks was pretty short too, so 2 weeks definitely. Like you could definitely do a lot in 2 weeks, and there's a lot of traveling too. But 2 weeks you can definitely get it done. I was thinking more like before, since we were on like a time kind of crunch, since we were going like traveling to like different countries and stuff.
Yeah.
That would be. And didn't you mention you want to do it like even more different countries as well, like Nigeria and all those other countries?
Yeah. Hey, Raphael, I can give you more information myself. The website, the only thing that's on the website is just applications. Application is the only thing on the website, but you can also just email me. You can email me directly too. You know, you can just either apply on the website or email me directly. Yeah. So
I
yeah,
have a
that's.
question.
Uh,
Oh, there you go. Just you can. Raphael can go first. Oh, okay. My question is, what was the most difficult medical scenario you faced when you were abroad, if you had any?
yeah. Oh my goodness. A while ago. A while ago. So there are a lot of medical challenges, and that's what I like about this. You know, a lot of times you get all these bread and butter cases, but there's always this one case that's like a curveball, and you've never seen it, and it's like, oh my goodness, what's happening here? You know. Uh, I A couple years ago, I had this guy who came to me with this rash. It was a really strange rash that he was not sick, not febrile. He didn't have a fever. He didn't have anything. He had a white count. His sexual history was um, um, clear. He didn't have any bad sexual history or anything, and he had this rash, you know. And I was like, Jesus Christ, I just couldn't solve that, you know, and I had to video chat my friends, my colleagues from my colleague dermatologist, you know, from New York City. He didn't even know what it is, you know, but at least it was good. The dermatologist doesn't know what it is, so I don't feel as bad if I don't know what it is either, you know. But it was just an interesting case, you know, and I went back to this guy 3 days later, and the rash was still there. I'm like, Jesus Christ, what is this, you know? And he was fine. He was fine, and it was a really strange case. There was another case too. That was very easy to diagnose. It was a case that you probably would never see until you travel abroad. You know, elephantiasis. You know, it's just when they get infected with these worms, and one of their legs will get swollen because the worms will clog their lymphatic system, and their feet looks like the feet of an elephant. You know, and we had that case. It was just pretty cool to see and treat. You know, we treated that patient, and it was good. But it was good to see that case. You know, that was the first case I had ever seen. I trained in New York City. There's no elephantiasis in New York City, so it was good to see that and treat it. You know, it was good. One time, there's a varicose node. A varicose node is when you have cancer, and then there's a node here. You know, there will be a node right and like on your left side, right above your shoulder, on your clavicle. There'll be a node there, and that's usually when you have cancer. That I've read in books a million times. I've never seen it until I saw it with my students a couple years ago, and that was pretty cool to see. That yeah, it's just. And when I told him that, hey, dude, you're a really cool case for us. We took pictures and videos and brought it here and showed it to students in LA, but you're in a lot of trouble. You need to go get some care in the big city.
I have another question. Are there any practices that you use abroad that you can't necessarily use in the U.S., or are there things that you do in the U.S. that you can't do abroad?
That's a good question. Yeah. Well, medicine is medicine everywhere. So I guess everything that applies here applies there too, except that there's a lot more oversight here. You know, yeah, there's a lot more oversight here than there is abroad, just because the resources are very limited. You know, but medicine is medicine everywhere. What we do here is what we're supposed to do there. You know, and I try to have us respect the patients as we would respect the patients here. When I go to clinic here in Los Angeles, I dress up, wear a tie, and wear a suit. When I'm in Africa going to the villages, I'll dress up, wear a tie, and wear a suit because I want to respect the guy in the village in Africa. Like I'm respecting my patient worth $20 million here in LA. You know, I treat them the same and I approach it the same. And, you know, medicine is medicine everywhere, you know?
Hi, Dr. Kubi. I had another question.
Mhm.
What was your favorite and least favorite things about your medical missions?
Favorite thing. So the favorite thing was just being able to help people. You know, one time I I saw a patient. She was an older woman, probably in her 60s or 70s, maybe 60s, close to 70s. You know, and she had a UTI for like years that had not been cured. You know, and I saw her and I was able to give her the medications for that. You know, I gave her medications for UTI. We tested her; it was positive, and we treated for that. And she's like, "Doctor, I want to tell you something. Um, that she was very religious. Like, yeah, God says, bless the helper, and you're the helper, and bless you. And she gave me a long speech, a long thank you, and I really appreciated that. And that was one of my favorite things about the trip, when these people are genuinely appreciative. It's more than any paycheck you can ever get. They don't pay me money, but just the appreciation in their faces is just out of this world. It beats any payday in Los Angeles, and uh, that's usually the best part about the trip, just helping them, and they being genuinely appreciative, and I just love that, just. And least favorite thing about the trip, I don't know, I don't know, well, sometimes it gets difficult. Sometimes it gets difficult. The traveling to all these places, and it gets very difficult sometimes with really bad roads, and have to sit on this bus for like 2 hours going just on a bumpy. It's like Six Flags for 2 hours, on a bumpy ride, and go into a village, and you get there and you're tired. And now though, I don't have to drive. Before, like a couple of years ago, I had to be the one driving. I would drive back and forth, and that was the worst, After like 6 hours of seeing patients, I had to drive 2 hours on these bad roads, and I just wanted to like shoot myself. But now we have a driver who drives us around, so it's no longer a problem now. But a couple of years ago, that was horrible, just the driving, having to, like, we would go and just leave everything out there, give 110%, and we would be like exhausted at 3 p.m. No, not even 3 p.m. Like 2 p.m. we'll be done, but we'll be exhausted. And having to drive an hour and a half back to the city is just the worst. But we have a driver now, so it's good now.
Hi, Dr. Kubi. I had a question. Can we study abroad while also volunteering with your organization?
You can study abroad, just not through me though. There's a university. There are multiple universities in the country. There's one that you could do, and they have study abroad programs. They're very open to international students coming, but not through me. It's not something that I've considered. It's probably maybe something that I should consider. But
so we're allowed to like travel back and forth from the university to the clinic?
Oh, travel from the university to the clinic?
Yeah.
Yeah. Usually, our trip is when the universities will probably be on break, because we usually go during the Christmas period, The universities may probably be on break. They may have time off. But yeah, it's definitely possible. You can definitely volunteer abroad. And yeah, they have the University of Ghana. It's right in the middle of Bougieville, in the bougie part of the city, So, yeah.
Okay, thank you.
Hi, Dr. Kubi. I have a question.
Sure.
So what is something you learned during a mission trip that you didn't expect to learn?
Very good question. So when I was a student, when I was a medical student in med school, when I would take my friends, I learned very quickly that. So I thought I was going on vacation. So they were definitely going on vacation. I thought I was going on vacation too. That was the first thing I learned was that everyone else is coming on vacation. I'm not going on vacation. These were my buddies. But the minute we got off the plane, you are now in charge, like, hey, it's hot. Oh my goodness, this, like you have to always constantly, be attentive to them and solve their problems. And it was good. It was a good realization back then when I was a student, when I would take my best friend and I'm like, yo, let's go to Ghana and volunteer. And like, okay. And then we get there and I'm like their dad already, but it's good. It's good. It's good to be able to understand things from students' perspectives. I've grown to, kind of had pluses and minuses, known how to manage people more, and I have someone there who kind of manages everyone, like Ben. Ben would manage the whole team, and that takes a lot of pressure from me because my expertise is in medicine, so. Ben definitely helps in managing everything so I can focus on patient care and he can focus on getting food there and getting food back. So that was one thing that I had to realize, that taking care of the people there is just as important as taking care of the people going, taking care of the students and the doctors who volunteer is a big part of what we will do. So now I'm just you probably should dedicate 50% of your time to the patients there and 50% of the time to the team coming from the United States, because they definitely need, it's unusual for them. It's just a foreign place, so you need to understand them and just meet them halfway, and just know that, hey, maybe they can't eat the okra soup that we eat. They need a burger. Just to understand these things, these minor little things, and hey, maybe the data that they're used to 4G, and just coming down to 1G is a big problem for them. So knowing that once in a while, every week, maybe every day, just drive them to the city where there's 4G, so they can at least FaceTime or send all their updates and upload all their pictures on Instagram or Snapchat. Understand that they need that. 1G is not. It's so just understanding people, and it's good. It's good.
Thank you.
Hello, Dr. Kubi. I have another question.
Mm-hmm.
So what was your most inspiring trip, and what happened in it that made it so touching?
I think this most recent one was my most inspiring trip. It was my most inspiring trip because of the clinics we built. Because before we would just go and see patients and just adios, a la casa, I'm gone. But now we've actually built clinics and made it more sustainable. And also this time around, we went and a lot of these chiefs and the queens and the kings really took to us, and they supported us, and that was pretty cool to realize that we have help and support from the guys in charge. There were kings who will come into our homes. I don't know, Nawab, if you remember, there was one king came home one time. We're having breakfast.
Yeah, I woke up and he was just in the living room. I had no idea what was going on.
Yeah. It was this king I see on TV, and I'm eating breakfast, and he shows up to my house like, oh my God, what is this guy doing here? But yeah, he just showed up like, hey, I want you guys to come to my kingdom. I'll give you guys a big piece of land, and if you want to develop a clinic there, you're welcome to, and we'll give you guys free manpower and this and that, all the supplies you need, and just come in there with your know-how, and we'll provide everything for you to set up your clinic. So that was pretty cool that the chiefs and the kings were giving us everything that we need. So they'll give us everything to build a clinic. They just need our technical know-how to direct them. So that was pretty inspiring to see the local leaders just take to us like that.
Thank you.
Are there any more questions from anybody?
All right. Well, hey, I'd say you guys should definitely keep up the hard work, and there's strength in numbers. Just get together, however much you can do, however little you can do. It's not above you. Trust me. You may be freshmen or sophomores, but you have a lot of power to affect change in your little communities. Global health includes what's the poorest community on Long Island. Maybe just go around the corner and just help people. Teach them whatever you learn. That hey, an orange a day keeps the doctor away. If that's the only thing you can teach them, just do that. Just go into communities, just go into middle schools and tell them that. Just eat fruit. So definitely that, and you can definitely make a big impact in your communities. So, all right. And definitely feel free to call me, text me, email me, right? And I'm always available, always open. And if I don't pick up, I'll call you